Hi, I'm Scott Hollinger, the Chief Executive Officer of Silver Oaks Behavioral Hospital. With me today is Dr. Jyoti Randhawa, the Chief Medical Officer of Silver Oaks Behavioral Hospital. Dr. Randhawa is a board-certified adult and child-adolescent psychiatrist. And Dr. Neeraj Shah. Dr. Shah is a board-certified internal medicine physician and the Medical Director of Primary Care Joliet and the Co-Medical Director of Silver Oaks Behavioral Hospital. Welcome, both of you.
Thank you.
Thank you for having us.
Well, thank you both for taking time today to answer some of the many questions that we've received at Silver Oaks regarding COVID-19. It seems every day more and more information keeps coming out and more questions keep coming up. So let's get started with some of the questions that we've received. We've all been inundated with all of the information regarding COVID-19. But Dr. Shah, this week, the CDC added more symptoms for us to be aware. Can you tell us what those symptoms are and why they were added and why we need to watch for these?
Right. So as you stated, the CDC has added more symptoms to be on the lookout for. Traditionally, we've told patients to look for a new onset cough, to be aware of if they're having any shortness of breath or if they're having any fevers. In addition to that, they've added numerous other symptoms, including rigors, which is a sense of feeling cold and shaking, chills, a loss of sense or smell, headache, or sore throat. They are not necessarily signs that you have COVID-19, but could point to it potentially.
Okay. Well, Dr. Randhawa, shelter at home is what they recommended as the best way to deal with COVID-19. But why is this such a challenge for people with mental health concerns?
Well, I would think because usually we promote social interaction for our patients. Part of the treatment modality for depression, anxiety, or anything is to interact with other people and to socialize so you can work on your coping skills. And when we have a shelter-in-place order, people cannot leave their home, they're by themselves, and they're isolating, which kind of goes against the treatment model that we promote. So when people are by themselves, they don't get to utilize those coping skills, and that can increase the chances of them getting worse or having some other negative outcomes.
And what should we tell our kids as the weeks go by and the shelter at home continues now that it's been extended to May 30th?
Well, I know that Dr. Shah and I were talking about this earlier, that for kids, you have to normalize the information and present it in such a way that it makes sense. You first need to know your information from legitimate resources and then give it in pieces that children can understand and normalize it so it's not something that can be taken out of context. So this is where we're talking about how the way you as a parent present the information is how the child will pick it up. So if you're calm, collected, and it's okay, the child will pick up that same energy, right? And then also kind of validating any of the concerns that kids have, that this is not fun, I'm not enjoying this. And as a parent saying, I hear you, it's true, but we're going to get through this together.
So Dr. Shah, when we're sheltered at home, how do we know then when we need to go get medical treatment?
Good question. So as mentioned, you want to look for the signs or symptoms that the CDC has laid out on their website. And if you feel like you have those symptoms, to call your primary care physician right away. We really don't want patients going straight to the emergency room, as that can risk them acquiring COVID-19 or spreading it to others. Many primary care physicians, including our office at Primary Care Joliet, offer televisits. And so please check with your primary care physician if they do. That allows you to consult your physician in the convenience of your own home without risking spreading infection to others or acquiring it yourself.
Well, many people are afraid they're going to get this virus. So both of you, what do you tell patients who are so fearful about that?
Right. Yeah. So I'd like to use an analogy here. If somebody were afraid to drive a car because of getting in a car accident, I certainly couldn't tell that patient, you're definitely not going to get in a car accident. But what we do, and what we all do typically, is we prepare ourselves as best we can to minimize any adverse events. So in terms of driving a car, we'll make sure we're purchasing a car that's safe, that has airbags. We'll make sure that we set up our mirrors so we can see all sides of the road, and we'll obviously wear our seatbelt. Now, again, we're preparing ourselves for the worst case scenario and minimizing that risk. Similarly, we can do a lot of the same thing with COVID-19. Can I tell patients they definitely won't get it? Of course not. But if you practice good social distancing, staying more than 6 feet away from others, if you avoid large gatherings, if you wash your hands frequently, especially before touching your face, well, you're doing everything you can to at least minimize that risk.
And Dr. Rendawa, what are some of the things you tell your patients who have these same fears?
Well, I tell them that there's things that you can control and things that you cannot control, and you do your best with what you can. All right, so you cannot control the outcomes of society, but you can take control of taking care of yourself. All right, food, shelter, sleep to the best of your ability, knowing that you have to think outside the box at times and be flexible with the changes that are currently occurring in the economy and in the world. And then also understanding that this is a time-limited situation. Time will help us get through. And sometimes having that light at the end of the tunnel can be very reassuring for patients.
One other question, Dr. Rendawa. How do people know if this is affecting their mental health or the mental health of someone in their family or inner circle?
I always look at changes, Scott. I mean, changes from your own baseline. I think people should have a better understanding of themselves than outside folks. And that means, are you noticing that you're not sleeping well, you're not eating, you're not interested in food, you're not interested to talk to people that you used to talk to in the past? So there's changes in yourself, and people who are close to you can pick up on that too. And then the changes in others around you, people who used to engage with you readily are not doing that anymore. They're isolating, they're not responsive. So those are the changes to look for as flags for us to pursue in terms of, do we need to do more of an evaluation or not?
So before we go, I'll ask both of you, what are the 2 or 3 things that are the key points people need to remember today?
Yeah, I would say first and foremost, make sure you're getting your information from a trusted source. I recommend going to the CDC website. As you mentioned before, they are updating as we learn more and more. This is a live animal, live beast, and we are trying to understand it each week more and more. So go to the CDC website, use that source frequently, and stay updated. Number 2, continue to practice good social distancing, hand hygiene, and do what you can to minimize risk of spread to yourself and others. And if you are feeling more stressed out, as Dr. Rendawa has mentioned, understand yourself. And if you feel like you need to seek medical care for your mental health, please do so.
Mm-hmm. Thank you.
Yeah.
I agree with Dr. Shah. You know your resources. The hand hygiene is huge. Just basics that we can all participate in will help in terms of bringing down the numbers and making sure we get through this. And then if you notice that things are not getting better, you are not able to cope, reach out, call, go online. Somebody will be there. We're here.
Thank you both. Appreciate it.
Thank you.
Thank you.